everyone. This is Stephen Ferrara, Executive Director of the Nurse Practitioner Association, New York State, and we are here with another episode of the NPA Q A. Today I have nurse practitioner owner Argelia Diaz, and she is the owner of Lighthouse Adult Health. Welcome, Argelia.
Thank you. Thank you. I'm glad to be here.
Yes, thanks for being with us. So this is our third episode of the NPA Q and A, and it's really just a way to get to know some of our Nurse Practitioner Association New York State members. And the first question, a pretty easy one, can you tell us a little bit about your pathway to becoming a nurse practitioner?
Okay, so I started really young as a nursing assistant, actually. And then I would watch the nurses care for the patients, and that really gave me the motivation and the passion to go and move forward with that. So then I became a nurse and registered nurse. I was working at a hospital, and then at that time, I also was able to see what nurse practitioners did for their patients. And then I said, oh, okay, well, I think I want to do that. And so that's when I went back and registered for nurse practitioner school, and that's how I became a nurse practitioner. And why? That's
great. And how long have you been a nurse practitioner now?
I graduated in 2012, so 8 years.
Great, great. So you are a unique nurse practitioner because you're one of the few nurse practitioners who actually own their own practice. And we're seeing more and more practices across New York State and across the country, but you are certainly a pioneer in that space. So why don't you tell us a little bit about how you started your nurse practitioner practice and why?
Okay, so I didn't even intend to do this because I thought it was just too difficult, but I was working at a place and it got to a point where I was dissatisfied with the time that I was allowed to see the patients. Because as we know, or if you guys don't know, as nurse practitioners, we, focus on prevention, and that takes time. That takes time of teaching to the patient. And I didn't have that. And I wasn't satisfied in the care that I was given. So I was just down and I was like, what can I do to change this? And then at that same time, I received an email about being an NP owner. And I was like, wow, look at this. So then it just, it was ironic that at that same time I was off from work. I was on vacation. So I said, I'm going to go to this conference. So I went to the conference, and there I met with people just like me that wanted to do this but didn't know how to. And I met someone that helped me through it.
That's excellent. And your practice is located, tell us where your practice is located.
We're in New York, in Suffolk County, in a town called Bay Shore.
Mm-hmm. And can you give us a little bit of insight into your day? You've mentioned that you really want to see patients in a way that gives more time to them. So what does a typical day look like for you?
Okay, so I like to have a certain amount of patients. I don't want too many patients here at the same time. We're by appointments only. We do see patients, if they have an emergency, we do have slots for that particular reason, because we don't want just patients sitting here and that it doesn't allow me the time to talk to them. So they come in, it starts at 9:15. They come in, they check in, and then I go in and I allow myself 20 to 30 minutes with each patient so that I'm able to do what I need to do for the patient.
Great. And do you have, do you hire staff?
Yes, so I have a medical assistant as well as a front desk person.
Excellent, excellent.
Yeah. So
and what year did you open the practice?
We opened in 2017, so it's 3 years now.
Okay. And of those 3 years, what have been some of your successes that you're most proud of over these last 3 years?
Well, when I went to that conference at the beginning, they told me you have to have a business plan. And I'm like, what's that? So then I started researching, and they taught me how you have to have or offer to the community something that nobody else is offering to them. So I did my research and I came up with obesity. Obesity is a chronic condition that it's, it's very difficult to manage, and not everyone can do it by themselves. They need some help. So I invested in that. I got educated in that. And therefore, I have a lot of patients that come here for obesity management, and they're very successful.
That's wonderful. And you get to actually work with them and see the results, and hopefully they're mostly good results. And that's got to be very, very rewarding for you.
Yes, yes. For the most part, it is, because it is hard. Not everybody can do it, but for
Right.
the most part, they stick to it, and it's working. And so that's very unique for my practice. And because of that, when I treat somebody for hypertension or diabetes, I always want, have that on the back of my mind. Depending on the patient's weight, that's how I manage them. I don't just, that's very important to me, because
Right.
I
So,
already do obesity.
right. So the obesity part is only part of your practice, and you're primarily primary care. Is that how it works?
Yes, I'm primary care. I mean, the last year I added some aesthetics as well.
Hmm.
So, it's basically like the patients can get care as a whole, if they want not just their illnesses, but also if they want to look better, get some treatments, we do that as well.
That's great. And with the successes, there's usually some challenges along the way. What are some notable challenges that you've experienced, and how did you overcome them?
Well, the first year was very hard. I would say the first year and a half, because, the insurance companies take a long time for credentialing.
Yeah.
And that was one of the biggest challenges. I was already credentialed where I was practicing before, so I thought it would be easier. But it turns out that it wasn't, because this is, as a new office, I had to credential the office as well.
Right.
And another thing, as a nurse practitioner, some insurance companies do not know that we can practice independently. So sometimes they're asking for an MD, and then we have to educate them and say, no, there's no MD here. I practice independently. The majority of the insurance companies are okay with that, but there are a few that are not. So that was a challenge at the beginning, but then, that I didn't let that get me down. I said, well, you know what? If I get accepted to most of them, that's fine with me. And the ones that I don't, then we just keep moving. And that's
Right.
it.
Absolutely. And you and I have been in communication. You've reached out to the Nurse Practitioner Association, New York State, about some of the challenges you've had with some insurance companies, and it is an issue. And I wish we had it all resolved, but we continue chipping away and explaining to insurance companies what the laws are in New York State and what's required and what's not. And we try to do our best to educate them and increase access for their insured. So I know we work on that, and we will continue working on that for sure.
Yes, absolutely. The NPA has been, very supportive. I've reached out to you, and you got back to me right away. You contacted me with the person that I needed to speak with regarding this issue. So the NPA has been, extremely supportive.
That's great, and we're very thankful to highlight you and your work. So my final question for you before I open it up and let you just talk about anything you'd like is, what advice would you give to a nurse practitioner who's contemplating opening up their own practice, or has just opened up their own practice? What kind of advice or tips would you give to them?
Okay, so if I was to do it over again, what I would do differently is I probably would have retained a part-time job for income, and then open part-time.
Hmm.
And because at the beginning I had a lot of time on my hands because of the insurance companies.
Right.
A lot of the patients around here, they have insurance. So although they knew me from a different practice, even though it was far for them, they were willing to come to me.
Right.
But I couldn't take the insurance. So I had a lot of time on my hands. I did use it for, to credential. I did my own credentialing. I learned that because I had the time. So I used it for that. I also used it to educate myself on obesity. I went on a conference. So I used it. However, I think it would have been better if I would have retained the part-time job at
Right.
the beginning.
Yeah. Are you, and you have a traditional office, right? Your storefront, if you will. And how many days a week are you open?
We're so busy. We're open 6 days a week.
Wow. Well,
Yeah.
I think that's a good problem to have in
Yes,
some
yes.
way. It's better to have more patients than not enough patients. We all worry and struggle with that for sure. But
Right.
6 days a week. So how do you do it 6 days a week? Do you have additional help, or are you on call all the time? How do you manage?
Well, I try to take care of everything ahead of time so that we minimize the calls, right?
Mhm.
But I do have an app where I just turn it on when I go home and I'm on call all the time. Because of my EMR, I can do whatever I need to do at home.
Right.
I'm blessed to have a team that supports me and works hard with me. What we do is Thursdays, we try to not see patients and catch up on paperwork and see emergencies only, and like, close early, like today.
Hmm.
But all the other days we're really busy. And actually, we're in the process of getting like a little built-in for my office because we already outgrew this little office.
Wow.
So it's very hard at the beginning. But my, advice to nurse practitioners that want to do this is do it. Do it. It's very rewarding. You can be a change to your community,
Hmm.
to your patients. My patients do very well. I'm not sure if it's because of I actually talk to them, they like
Right.
that.
Absolutely.
And they try to follow what I teach them. And very few patients don't do so well, non-compliant, but for the most part, we treat them, like family. I guess it feels personal to them. That's how
Sure.
that's what we want to, show to the community. And
Right.
we've been very successful. That it was just the first year that was really hard because of the insurance. But after that,
Right.
little by little, word of mouth, I didn't really do much um, marketing.
Hmm.
I did do some and it didn't really work. It was mostly word of mouth.
Wow. Well, that's the best advertising, right? When you have a
Yes.
happy patient that tells all of their friends and family. So that's wonderful.
Right. Right.
And as far as COVID and all of the challenges we've all faced with COVID, have you utilized telehealth over this time period? And how has that worked out for you?
I did. I did. We never closed. We were so busy. We would never close. At first, it was challenging because no one knew how to handle this.
Right.
But once we got a handle on it, it was fine. We helped a lot of people, and we did offer telehealth at that time.
That's great.
Now things are better and calmer, and I tell them I prefer to see them in person because that's how you really assess someone.
Yeah.
And we have all the recommendations from the CDC. Right now, we see one patient at a time in the waiting room. They wait in
Mhm.
the car. We wear our face masks. They do the same, a lot of cleaning. So that was a challenging time, but we got through it. We worked hard. We helped a lot of people. We never closed. Some of the offices around me closed, but we never did. We actually worked extra hard at that time. And because of that, I actually have more patients now because they're like, wow, you're here. People were shocked that we were still open, but I'm like, I'm a nurse. Like, I can't just leave the people, leave my
Right.
patients because of fear. No, we're gonna, be careful and wash our hands,
Hmm.
and
Hmm.
that's fine. And none of us here got infected or anything. And we did see a lot of patients that
That's
were infected when we didn't even know at the time.
wow. I'm sure. Yeah, we've all
Yes.
dealing with it in our own way.
Yeah.
But I'm sure your patients are quite thankful that you've been available and accessible this whole time. I know, across New York State, there's been a host of different types of access. Some telehealth, some telephone, very little in person. For non-COVID related issues. So I'm sure that that's been quite a feat for you to be able to continue to see your patients. So congratulations on that.
Thank you.
You're welcome. At this point, I open it up to you. Is there anything you'd like to share? Do you want to promote your practice, or want more patients at this point?
I mean, of course, we always want more patients. So my practice is in Bayshore, New York. It's called Lighthouse Adult Health. The phone number is 631 518-6040. We are on Instagram as Lighthouse Adult Health and on Facebook as well.
That's great.
But one thing I do want to say is, again, there, you're going to be nervous, you're going to be a little fearful, anxious. That's all okay. That's a good thing, because you're going to explore something new, and you're going to like quit a job, or maybe, go part-time to go and open your practice. But what I do advise is find what it is that is missing in your community and get trained and get educated on that, get ready, and then open. It's very rewarding.
That's amazing. And I'm going to assume that you're at a point where your practice is financially successful, whereas, you're able to continue the practice and live your life. I think that's one of the many challenges that nurse practitioners think, that they're going to have to be going 24/7. They're doing that for someone else, but then if they do it on their own, then you add the on-call and, the business ownership pieces of it, and it could seem certainly overwhelming. So I'm gonna take you as an example and say you can do it. You can balance your life as well as, having a practice that's thriving and successful, and, you're doing what you love to do in the way you want to do it.
Right. Like you hit it on the nose. You said that we're already doing it for someone else. So if you're doing it for someone else, why not do it for yourself?
Right.
And you can control it. You have the control. And you're going to dictate how you're going to do it. The on-call is really not that bad. As long as you educate your patients. We also have messaging that they can send you a message. It doesn't have to be just calls all the time. There's a way to manage it. I work 6 days a week now, but once we go to our new place, hopefully very soon, my plan is to hire another provider, so that because I think I could do this. My plan is to open, and then maybe January, hire someone else, maybe part-time, so I can have some weekends off. Right. And then, my dream is to have a nurse practitioner center. That's what I dream of.
Well, that's amazing, and we wish you luck. We're going to check in with you later, maybe early next year, and see how the new place is going. And we definitely want to hear about, your experience and follow along your pathway. So, Argelia, thank you so much for taking the time to share your experience with us. And we wish you so much success and luck.
Thank you. My pleasure.
You're welcome. So thank you, everyone, for watching the NPA Q&A, and we will see you next time. Thank you so much.